Hi, I'm Timothy, and I'm a licensed clinical social worker in therapeutic practice. Now, if you're watching this, you must be thinking about therapy. And what I'm hoping to do in this video is give you a little introduction to what therapy's like. If you're thinking about therapy, it probably is making you a little nervous, a little anxious, and that's okay. In fact, that's completely normal. You've never done therapy before, or if you've never done therapy before, you have no idea what it's like. So, of course, it's going to make you nervous. Even if you have done therapy before, it's with a new therapist or in a new office, and you don't know exactly how that's going to work either. And so that'll make you nervous or a little bit anxious, and that's okay. What I want to do is help you understand what the first part of therapy is like in this video. That hopefully it'll make you feel a little more comfortable when you start therapy with me or with anybody you might go see. Now, it's important to remember that this is what I understand and how I do things, and that some therapists might do it differently, but in general, it should be pretty close. Now, my number one goal for therapy, and when anybody comes to see me, is that you feel safe and that you feel like you can talk about anything and you can trust that anything you talk about with me won't go anywhere and that I'm not going to judge you. And I really want you to understand that. I am not going to judge you. I don't want you to live your life based on what's important to me. I want you to live your life based on what's important to you. I want you to live your life based on what you think's important, what you think's valuable, what relationships are important to you, and how you want to live your life. In fact, sometimes part of what happens in therapy is you discover what is valuable to you and what is important to you and how you do want some of your relationships to work. But again, my number one goal is for you to feel safe and know that this is a confidential space where nothing's going to go outside these four walls, or if we're doing video, outside the video. Now, and by video, I mean telehealth. It's encrypted and HIPAA compliant and all safe too. Now, when I say that, it's so important to me that you understand that a rule I have is you never have to talk about anything you don't want to. And that's very important. I never want you to feel pressured to talk about anything. I never want you to feel like you have to talk about anything. I want you to talk about whatever it is you need to talk about when you're ready to talk about it. And the fact that you're even thinking about therapy probably means that you're ready to talk about something. Maybe something you haven't talked about before, or maybe it's something that's just going on in your life now, or some questions you have. But chances are you're probably ready to talk about something. And when you come into any therapist's office, I hope you know that you're going to be safe and be able to talk about anything you need or want to talk about. Now, when you come into therapy, it's important to know some things that it's not. Well, number one, it's not venting. It's very helpful to vent to people, and sometimes you may vent if you come and see me, but that's not really the goal. It's also not about coming to get my advice about how to live your life, because I'm not going to do that. I want you to live your life based on what's important to you. Now, I will help you discover that. I will give you some ideas on how you might want to do some of those things based on evidence, but I'm not going to tell you how to live your life. The other thing that therapy is not a place to get fixed. Therapy is a place where you grow, where you learn things about yourself and about others, where you come to understand things that are important to you and come to understand maybe things in your life that haven't quite made sense to you or have been very hard to handle. It's not about getting fixed. It's about learning how to live. It's about becoming the person that you really want to be. It's about awareness of who you are. And a lot of times it's about accepting yourself and having compassion for yourself as well as others. Now, different therapists use different approaches. We often call them modalities. You may have heard of some of them, like CBT or psychoanalysis or EMDR, or the one that I'm kind of partial to is acceptance and commitment therapy. In a lot of ways, those aren't overly important. They're all useful, but the number one thing that's important is the relationship that you have with your therapist. In fact, study after study after study shows that the relationship you have with your therapist is the number one predictor of how therapy is going to work for you and if it's going to be helpful for you. So when you come in, it's important to understand that that relationship is important and that it is a relationship. It's collaborative. We're going to be working together. I'm going to be working with you to help you discover new things about yourself. And so you've got to feel confident in me, you're going to need to learn to trust me, and you're going to need to learn to know that you're in a safe place. And you may not have experienced very many safe places, but I hope that this is a safe place here, because together we're going to be able to figure out what matters most to you and how you want to live your life. Now, the first couple sessions that you come, there's probably going to be some specific things that we're going to need to do. In fact, before you even get here, I'm going to have you fill out some forms. Some of it's some basic information that you would expect. Some of it's a little bit of history. Some of them are assessments. So, for example, I'm going to want to know kind of where you're at with anxiety and depression. I'm also going to want to know a little bit about some things that may have happened to you before you were 18. Now, I'm not going to want to know details about those. It's kind of general categories of things that may or may not have happened to you before you were 18, because that'll give me an idea of some of the areas that you might need to work on or might be coming to see me about. Now, as helpful as all that information is, let's be honest, it's some words on a piece of paper. I can't really get to know you very well just from some words that you put on a piece of paper. So that first session is going to be about explaining kind of the process, helping you know how I operate, but most importantly, me starting to get to know you and you starting to feel comfortable with me so that we know how we can move forward and what that will look like. And I may say this more than once in this video, but if you come to see me and you're like, I'm not so sure if that's the right guy, that's okay. I want you to see the therapist that's right for you. So if I'm not that person, please let me help you find the right person, because I'm willing to do that. So when you come in, we're going to talk a little bit about your family, some of your relationships, maybe what school was like for you, what work is like for you, a little bit about your mood at various points in your life. It's not like a test. There's not right answers. I just want to get to know you, and I want you to share that with me at a pace that you're comfortable with. Again, we're building a connection of mutual respect, mutual trust, and again, I want you to know I'm not going to be judging you. We're also probably going to talk a little bit about scheduling, policies, fees, insurance stuff, the stuff that we don't like to talk about, but we have to, but we'll walk through all that as well. Now, once we actually start therapy, what does it look like? Well, it looks a little bit different for everybody. Sometimes people come into my office and I don't say hardly anything. They need to talk. And in fact, at the end of it, they might even say like, oh my gosh, I just talked the whole time and I don't know if that was helpful or not. And I'm like, well, you must have needed to talk about it. And what you're also doing is helping me understand you better so that I'll be able to reflect back to you some of the things that you're talking about that you may not even be aware of, or how they're connecting, or things that might be bothering you a little bit. Sometimes as we go through therapy, you come in and you're like, I don't know what to do about this. So we talk through it, and hopefully you come out with a lot more clarity. Many people, when they first come to me, anxiety is an issue that we all deal with to a certain extent, as well as a little bit of depression. So the first couple sessions might even be some very practical things that will help lower your anxiety on a daily basis. And it'll look, and hopefully you'll feel like progress is being made right away. Sometimes, as we move through that, it may feel like therapy is not doing a whole lot. Like you might be coming in and talking with me, and we might be clarifying some things and going over past, but you're not really sure how it's making a difference in your life. And that may be because we haven't quite gotten there yet. Maybe there's part of it that we're not quite understanding yet, or we haven't quite got to some of the hardest questions that you need to deal with. And that's okay. Sometimes therapy can be very depressing. You can come to therapy, you may cry a little because you're talking about hard things or remembering difficult things, or maybe one of the reasons you came to therapy is something is bothering you, but as you talk about it, your brain, which is a connection machine, reminds you of some other things that have happened to you that also have been disappointing or hurtful or painful. And so you haven't thought about those in a long time, but now you're thinking about those. So you're like, why is therapy even a thing? Well, because you need to deal with them. In fact, when therapists talk about processing, what we mean is feeling what we need to feel about those things and being able to think about those things the way we need to think about those. And often that means thinking about them in a different way, which is how your therapist can be super helpful, is helping to see different aspects of your thoughts and think about things in a different way. Now, therapy is not always a straight line, especially because it depends a lot on each person, what they're working on, and what issues they want to work on specifically with, like me, the therapist they're seeing at the moment. What I want you to know is I don't do things like by some magic manual. You're not going to come in and, oh, on session 1, we do this. And on session 2, I teach you this. And on session 3, I expect this. That's not how it works. It's very much driven by you and what's going on in your life. And that's very important to me. I need you to lead me, and we're going to work collaboratively to deal with and navigate some of life's challenges. Now, there's some misconceptions and some fears about therapy. Sometimes people are afraid of the big one, which is I hopefully have already addressed, which is my therapist judging me? Well, I'm not going to judge you. I'm going to do everything I can to make this a judgment-free zone. Again, I want you to live your life based on what's important to you, not what's important to me. Sometimes people say things like, well, I don't know what to say, or I don't know what I'm supposed to talk about. Well, you're not supposed to talk about anything. You're going to talk about what you need to talk about. And I can ask some questions that sometimes help that going if you're a little bit nervous at first or you're not really sure what to say. That is to say, we'll figure it out together. Some people wonder, is therapy like what I've seen on TV? And my answer would be like, well, probably not, because it depends on what you've seen on TV. And you also have to remember that if it's been on TV, it's been edited and written for dramatic effect, not necessarily for a reflection of what a therapeutic process looks like. If you're feeling nervous, if you're feeling awkward, if you're even a little skeptical of what's going on while we're doing therapy, that's okay. That's okay. Therapy is a new experience for many people, and it takes time to get comfortable, and I'm perfectly good with that, and it's important for you to know it's okay. Now, I'd like to give you a couple tips about how to make the most of therapy, whether that's with me or someone else. The number one is be honest, even when it's hard. That's when good things happen. When we're able to say the things that we've never said before, that is often huge. In fact, one of the things that is the biggest compliment that anybody who works with me can give me is when they say, I've never told anybody that before. And that's a huge compliment because that means they feel safe here and they know I'm not judging them and they know that they can say and feel what they need to say and feel. So be honest. The second thing is bring up questions or concerns. If you're not sure why we're talking about this, or you're not sure why I'm suggesting something, or you're a little uncomfortable even with the direction that we're going, tell me. Let's talk about it because it's important for you to feel comfortable as we work through this process and work on what you want to work on. The other thing that's super helpful is to show up consistently and remember that change takes time and practice. One of the things I'll say when I encourage somebody to try a new behavior or try doing something in a new way is, now don't get too hard on yourself. Remember, your parents told you a million times to say please and thank you, which is a very simple practice, very simple behavior, and yet you still forget to say please and thank you when you're an adult. So it takes time to learn to do new things and time and practice. Remember, every therapist is not going to be the right therapist for you. And if something feels off, it's okay to try someone else. But I think it's helpful to have that conversation with your current therapist first so that they can hopefully refer you to someone who might work better for you. Now, the other thing I'd like you to remember is therapy is really for everyone. You don't have to be in crisis. If you are in crisis, I hope that you come and get help or go to the right place to get help. But most of us haven't figured out how to live all of life. Most of us have questions. Most of us have some feelings that we're not sure what to do with, or relationships that are a little bit more challenging, or parts of our life that just kind of don't make sense to us. Therapy is very helpful just to live a better life. It's simply a space where you can be real with who you are, be honest, you can be seen, you can be heard in a way that I hope you feel completely heard and not judged, and you can do it at your own pace. I hope this video, which is a little bit long, about the introduction to therapy has been helpful. I hope that it will encourage you to find the therapist that you need to find when you're ready to start therapy. If you have any questions, feel free to ask me. I'm always open to trying to help in whatever way I can. Please know that if you're in crisis, you can always call 911 or 988, which is kind of the mental health hotline emergency number. If you're in severe crisis, if you're thinking of harming yourself, please go to the emergency room, the closest emergency room to you, so that you can stay safe. And again, I hope this video is helpful, and I wish for you the best mental health and life that you can live.